let's begin with what is cervical cancer. Uh, will you move the presentation forward, Jitima? Yes. So, cervical cancer is cancer of the mouth of the womb. The womb or the uterus is the child-bearing pouch in women. So, at the mouth of it is the cervix. So, cancer at the mouth of the womb is called cervical cancer. So, we here have a pictorial representation of normal cervical cells and how cancerous cells look. Can we move on? So, who can develop cervical cancer? Any woman can develop cervical cancer, and some women have a higher chance of developing it. What is cervical cancer screening? So, essentially, the aim of any cancer screening is to detect the tumor in what we call a pre-cancerous state, to identify the disease because of screening. Because once cancer develops, then treatment is difficult, and if it is very advanced stage, death rates are also very high. If you manage to pick up a disease before it becomes fully cancerous, then we can very easily treat it, and that woman is actually cured of the disease. So this is the purpose of cervical cancer screening. So there are several methodologies that are recommended. The PAP test is what has been used for almost 100 years in the West, and this single test has been the most important weapon against in the war against cervical cancer. Principally, there is something called a conventional PAP smear, and we also have what we do, which is called a liquid-based PAP smear. This liquid-based PAP smear has much better results than the conventional PAP. Other tests that can be done are a HPV test. HPV test is a molecular or a PCR test. The other test that can be recommended is a PAP test and a HPV test. So the recommendation is that between 21 and 29, women should ideally get only PAP testing done. After the age of 30 to 60, a woman has three choices: either a PAP test every 3 years, a HPV test every 5 years, or a co-test, that is PAP test and a HPV test every 5 years. Cervical screening, the whole purpose of screening for cancer, not only cervical cancer, but any form of cancer, is to pick up the disease before it becomes fully cancerous, in what we call a precancerous state. So, in cervical cancer, typically, a woman when she's first sexually active picks up this HPV infection. HPV is a virus. Once she is infected by the virus, it takes about 10 to 15 years at least for her to develop cancer. So, the purpose of screening is to pick up abnormal cells in the cervix before cancer actually develops. So, one of the best ways to get screened for cervical cancer is to do a PAP test. So this essentially identifies abnormal cells. Basically, a brush is taken and cells are scraped from the cervix, which is then put on a glass slide, which is stained, and we examine it. So we can detect precancerous cells as well by this test. So if these precancerous cells are detected, then the lady can get treated for it, which will only require a minimum amount of treatment. Just maybe a small part of the cervix is removed. Not even you don't even need a hysterectomy, and then they can subsequently be followed. So, in fact, in most Western countries, they even retain fertility. They don't even get rid of the uterus, even if they have precancerous lesions. So, this is why it is important to get screened for cervical cancer. HPV testing looks for the virus that causes the cell changes in the cervix. So, who should get screened? How often should you get screened for cervical cancer? Most international recommendations recommend that women between 21 to 29 we usually do not recommend HPV because this is the age when all women get first exposed to HPV. Many of them do not progress. Say out of 100 women who get exposed to HPV, only 10 women will develop precancerous disease. Out of that, 2 or 3 women will develop cancer. So by the age of 30, usually most of them have got rid of their HPV, and 29. We recommend that only PAP tests be done every 3 years. After 30, a woman has three choices: either a PAP test every 3 years, a HPV test every 5 years, or a co-test, that is PAP plus HPV every 5 years. After the age of 65, usually women can stop being the screen, particularly if they've had like 2 or 3 negative tests. Say between 50 and 60 or 65, they had 3 or 4 negative tests. There is no need to prolong testing. However, particularly in our country where the screening rates are very low, they've never been screened, even at 60 or 65, then it is, regardless of their age, it is good that they get one round of screening done. If a woman has usually had a hysterectomy, that is removal of the uterus, and there is the uterus has been examined under the microscope, and there is no evidence of pre-cancer or cancer, then she does not really need to go for screening. But if the uterus has not been examined properly, or there is any doubt of any pre-cancer or cancer in the uterus, then even after hysterectomy, a pap test is recommended. What does it mean to get screening? Like I've already mentioned, screening is the process of picking up precancerous cells. It is the process of picking up a tumor before it becomes fully cancerous and it can spread to other parts of the body. So again, for cervical cancer, there are 3 ways, and we have spoken about this already. Either pap test, HPV test, or a pap test and HPV co-test. So like I already spoke about this, the uterus is the womb. It's a childbearing pouch in a lady. It is situated below the stomach. At the mouth of it is the cervix, and the cervix in turn leads to the vagina, which opens out. So here we are talking about screening for cancers of the uterine cervix. So this is typically how the test is performed, which is quite simple. The lady lies down on the observation table, and the gynecologist or the nurse uses the cytobrush and introduces it into the cervix, scrapes some cells off it. Then brush is taken out, the head of it is broken. It's put into a bottle of preservative fluid and it gets into the lab for additional processing. This process is not painful and it is not very time consuming as well. It just takes about 2 to 3 minutes, and it is not very painful as well. So briefly about human papillomavirus, I've also already spoken about this. HPV is first acquired by a woman when she's first sexually active. In 90% of the cases, the infection is rid off by the body by its natural immune mechanisms. So 90% of women who've been exposed to HPV no longer have it in a year or two. That is, they get rid of the infection. But in some people, and with particular subtypes of HPV, then it tends to stay in the body. It integrates itself into the cell, and then slowly the cell starts to become malignant. So this process takes about 10 to 15 years. So principally, in out of the 100 women who are infected by HPV, 90% clear it. The 10% who have a persistent HPV infection, in these women, the virus enters into the cell of the lady and it integrates into the nucleus, and the process of malignant transformation happens. Now, all this is asymptomatic. It is happening at the microscopic or at the cellular level. So there is no way that you can detect it without actually going for a test. And this is why screening is so important. HPV vaccination is ideally only for women who have not been sexually exposed. Currently, the government is recommending it in teenagers. Even women in their 20s or at whatever age there has been no sexual exposure, I would still strongly recommend that they do take the vaccine. So, what is the HPV test? So, again, this human papilloma virus is the virus that causes most cases of cervical cancer. So we recommend these tests only for women over 30. Like I already said, all women get infected by HPV, but 90% of them are going to get rid of it, usually within a few years. So there is no point in screening younger women because 100% of the women will turn positive for the test. Then there is no way for us to decide on what to do next. So typically, in younger women, we do only the pap test. So, which is the cytology test, and in these women, because the HPV has entered the cell, we can pick out abnormalities on the pap test. In women over 30, 30 and above, we know that the virus is now persistent. So we would recommend a HPV testing. And after 65, a woman can stop screening. We've already discussed this. So how do you get your screening results? Usually within a week or two after your test, you should get your result from your doctor. If you haven't, you should contact them and get the results. If your test results are abnormal, the doctor may ask you to come back to the clinic for more tests. However, you must remember that we are principally testing for pre-cancer. So out of 100 women, maybe 7 or 8 five or six, in fact, might have pre-cancerous changes. Even these women, in most cases, we only recommend follow-up initially. Only if the precancerous changes, low-grade precancerous changes, persist for say 1 year, only then we even recommend any treatment. It doesn't mean even if you have a positive test that you have cancer or that you immediately need to go for treatment. So actually, it is a very unfortunate fact that there is only 1% screening happening for cervical cancer in India. The World Health Organization is in fact recommending that 70% of women should be screened by 2030. Even most African countries have a higher rate of screening than we have. So why is it that we don't get screened? So it is embarrassing. I mean, obviously, it's a very you need privacy, so you have to overcome your inhibitions to go and get the test done. The other thing is you're afraid that it will hurt, or you could have some resistance from your partner or people at home. Yeah, of course, many people are in denial. Even if they do have some abnormality, they don't really want to know about it and they'd rather avoid getting screened. Some people feel that they might not be able to afford it, or they have logistics issues, childcare issues, and they feel they will not be able to go and get screened. I feel, in addition to all this, the most critical reason why screening doesn't happen is a lack of awareness. If everybody knows that cervical cancer is a major health hazard for women in our country, and if you knew that there was a test that could prevent cervical cancer, then I'm sure many women would get it screened. They would also pass the word around and make sure that people close to them, their mother, their siblings, their aunts, they would recommend everybody to get screened. So I feel it's principally a lack of awareness of both the seriousness of the problem and the fact that it can absolutely be prevented by a very simple, inexpensive, and easily available test. So I feel lack of public information is one of the most important reasons why we do not have enough screening happening. Next slide, please.
Yeah, I think overall last few slides are about some of the patient experiences. But overall, I think the problem that comes up is the lack of awareness. So, Ranjini, can you like elaborate what are the what is it that the men in the house can do to create this awareness? How should they approach the women to kind of take this test, or if the women are reluctant, what can be done at a local level?
Um, I would say, I mean, whether it's the men in the house or the women in the house, first of all, it's to be aware of the seriousness of the problem. About 70 to 80,000 women die of cervical cancer every year in our country. So it is a very serious problem. We have more deaths due to cervical cancer in India than anywhere else in the world. So that's the first thing. So it is serious and it can kill. So that I think we need an awareness of that. Second thing to be aware is that because of its natural history, the fact that after exposure to HPV takes almost 15 years for the disease to appear. So anywhere in this 15 years, if you get a test done, then and maybe HPV as well, then you would know that you're at risk and you can get yourself treated and you can actually prevent cervical cancer. So this is the second thing. First, that it's a serious problem and it has a long history. Three, it's that there are very good tests to detect the cervical lesions in the precancerous state. And four is that these tests are inexpensive, they're easily done, they're not painful, and they're quite reliable. So if you have an awareness of all this, then definitely you should be motivated enough and you should motivate all the women in your household to go for the test. So the more awareness there is, the more lives we can save.
So we have a question from Sajan. Thanks, Sajan, for sharing this. He is asking, what are the common symptoms for cervical cancer in general?
Well, like we mentioned earlier, there are really no symptoms, and here we are not waiting for cancer to develop. Obviously, once the cancer develops, there'll be a huge like mass. When we say mass, like a tumor, it could bleed. It will be obviously it will get infected. It will be painful. So, but we are not wanting it to reach that state. We want to pick it up in pre-cancerous state, right? And most pre-cancers will not have any symptoms. Occasionally, of course, there could be some increased discharge, cervical discharge, and maybe some burning or itching, but that could as well be an infection. Actually, precancerous lesions of the cervix are not really symptomatic, which is why it is necessary for all women to undergo screening. You cannot think that, okay, I don't have any symptoms, so I'm unlikely to have cervical precancer. So it doesn't work that way. There are no reliable symptoms. Most women are asymptomatic. When we say asymptomatic, that means they don't have any symptoms.
Thanks, Ranjini. Another question from Shagufta is that one, say, I might be able to elaborate on this. If LSIL and HSIL is detected, how does one manage it at a personal level? What should they do?
Basically, for LSI, which is low-grade squamous intraepithelial lesion, we usually, if we see LSIL on smear, we usually ask for HPV as well. So both are positive. Still, at least UK guidelines, we used to wait for another smear. Maybe 6 months later, we would repeat the test because most cases of LSIL will also disappear, will also regress. So 6 months later, if it is still persistent, they do something called a cervical conization. That is, they just take out that bit of the cervix and they send it to the pathology lab. The pathologist looks at it to see if it is all completely excised. We look at the edges of that biopsy, and if there is no lesion, then we say this is completely excised, in which case the lady is only followed up. For HSIL also, it's the same management. They do a conization or something called a loop or a lex biopsy. In fact, in the West, it is not even a practice to do a hysterectomy for a HSIL. But in an Indian context, LSIL, like I said, initial 6 months of follow-up, the lesion persists. Then, if the woman has not completed her family, she still wants to retain her fertility, she wants to have children, then you can go for the smaller procedures where a small part of the cervix only is taken out for LSIL or for HSIL. For HSIL, if family is complete and the woman has no intention of having additional children, then you can go for a simple hysterectomy. So this is the management. For LSIL, definitely just a small excision of a part of the cervix. For HSIL, either a loop or a lex biopsy of the cervix or a simple hysterectomy. I hope
So,
that answers your question.
yeah, Shagufta has a follow-on question. Is there
Yes.
no need for colposcopy in LSIL?
Yes. So that is the follow-up. Principally, see, this is cytology. Cytology is just a screening. Like I said, we wait for a repeat test. If the repeat test is also positive, then the patient gets sent for colposcopy where a biopsy is done. So this is the intervening stage. So after cytology, then usually it's practice to do a biopsy. And if the biopsy is positive, then go for a treatment.
Okay, thanks, Ranjani. We have a question from Sami. What are the guidelines for HPV vaccination? And from Sajan, there is a question on who can get the HPV vaccine. Is there like a specific schedule? So a couple of questions on HPV vaccination. And I think we can add like any specifics related to the HPV vaccine and how it goes hand in hand with screening.
Recommendation is to ideally vaccinate children before they're 18 years of age, between 14 and 18. The critical thing is this should be before exposure to HPV infection. Once they have had exposure, there really is no point in going for the vaccination. So women, even in the 20s, if they've not been exposed to HPV, then they can still take the vaccine. I think it is 2 doses followed by a booster dose. That's the schedule.
Okay, thanks, Ranjini. I think that answers the
And the
question.
recommendation is that both men and women take it. At least in the West, this is the recommendation that both boys and girls are given the infection. I mean, the girls are the ones who get cervical cancer, but it is transmitted through boys. So in the West, both boys and girl teenagers are actually vaccinated with HPV because the vaccine just doesn't protect against cervical cancer. It also protects against penile cancer and against anal cancer. And in fact, a significant proportion of oral cancers are also caused by HPV. So it prevents many other cancers as well. So in the West, now the recommendation is to vaccinate both boys and girls.
Yeah. Thanks, Ranjini. Just to add on to that, do check which vaccination you're taking against HPV. Say, for example, Cervavac only covers four strains of the virus, whereas Galaxil covers nine strains of the virus. So it is always recommended that even with vaccination, regular screening is done beyond 25, 26, that the age group of 25 to 50.
Yeah, just to reiterate that point, like Ritiman just mentioned, the initial vaccines are only for two types of HPV. Up to 13 types of HPV actually cause cervical cancer. So the commonest subtypes are 16 and 18. So Gardasil, which was the most commonly used vaccine, was only covering 16 and 18, but not the other 11 types of HPV, which also cause cervical cancer. So in spite of having the vaccine, women are required to go for the cervical screening. Now they have the quadrivalent vaccine, Gardasil. They've also come up with the vaccine against the nine strains, but these are not widely available and they're very expensive as well.
Any other questions, folks who are on the call? So there is another question from Sajan who is asking who is most at risk for cervical cancer?
Actually, like I already mentioned, it is caused by exposure to HPV virus, but this is not the only thing. The other sad part of it is socioeconomic status also matters. Hygiene levels, low socioeconomic status, and multiple partners. Actually, with multiple partners, what happens is there is repeated exposure to multiple strains of HPV. So these are the other risk factors. Most women are exposed to HPV, but 90% or 95% of them get rid of it. So the women who have multiple partners and who are of relatively lower socioeconomic status with less hygiene, with less genital hygiene, these are the women who are most prone to develop cervical cancer.
Thanks, Ranjini. Thanks, Arjun, for all the questions. I think any other questions, thoughts? Sorry, go ahead, Ranjini.
Yeah, that's what. Thank you, Sergeant. Please don't hesitate to ask us any more questions. Anybody who's logged in. We are here to answer your queries, and we really want to make a difference. Right, we've just started our journey in our fight against cervical cancer. So, any questions, we are more than happy to answer. And do please pass the word around. I mean, that is what we would really like all of you to do. So, if each one of you talk about this, about the issue, magnitude of the issue, and the fact that there is a very simple solution. So that would be really great.
Yeah. So thanks, Ranjini. I think if we can wait for maybe a minute till 50, like 3:35. If there are no questions, maybe we can close the webinar. But thanks everyone for joining in. Really appreciate all the questions from all the participants. Thanks for being curious. Okay, so Varun has a question. What is the government currently doing to spread awareness about cervical cancer?
In fact, I would say for the first time, the government is actually serious. Even recently, our Prime Minister had actually spoken about it. I think it was in the pre-budget speech, and even when he met Bill Gates, that the government is very serious. I think a big chunk of money also has been allotted to for cervical screening. All government healthcare schemes have money allocated for screening, particularly for cervical cancer screening. And more and more government agencies are indeed talking about it.
Thanks, Ranjini. So, okay, there are more questions coming in. What are the effective ways that you may know that we could include men in educational campaign about cervical cancer and HPV? And then there is another question from Sajan, which is how long can you live after diagnosing cervical cancer?
To answer that question first, in any cancer, survival depends on what is called stage. If it is early stage cancer, it's confined to the cervix. Most cancers we look at survival in terms of 5 years. Probably for stage one cervical cancer, the complete hysterectomy has been performed. The tumor hasn't spread anywhere else. Then the 5 year survival would be about 90%. That is, 90% of women would be alive after 5 years. But the higher the stage, the lower the rate of survival. Say stage 4 cervical cancer, and it has spread beyond the cervix. There are multiple metastatic lesions. Maybe it has spread to the brain, it has spread to the bones. Then the 5 year survival would be to the order of 30 to 40%. So, so survival depends on stage. Again, early detection. If we identify the cancer, it is still only in the cervix. About 90 to 95% of women are going to definitely live beyond 5 years.
Thanks, Ranjini. I think there is a question from Yash about how men can help.
Yes. So, well, like I said, I think we should be gender blind. I would say that, most men are concerned about the women in their lives, their mothers, sisters, wives, girlfriends. So they should turn around and they should talk to them about it, and they should also be part of the campaign. I guess that's how men can raise awareness. At least if the women in your life don't know about it, you should definitely motivate them, right? For your next Mother's Day, you should actually take your mother to get a screen for cervical cancer or, stuff like that. It might sound a bit extreme, but this is the way. I think you can show them this is how you care because you're protecting them from such a horrible disease.
So we have another question from Varun. What are the available options for screening for people with limited economical means or who live far away from gynecologists?
So this is the entire purpose of our journey. Not only we do something called liquid-based cytology, but we are developing an AI tool. Our endpoint is that we should be able to load our machines, that is our digital scanners with an end-to-end solution on a machine and have it reach every remote corner of India without any doctor and without any pathologist. The AI tool will be able to give a report. So we believe it is by leveraging technology that we can have that last mile accessibility. The government initially, particularly Tata Memorial, did recommend something called visual inspection by acetic acid, but it has been shown that this test is not very effective and it has not been shown to prevent cervical cancers. So we believe our solution is likely to be the most affordable test. I mean, we are trying to keep the cost very low, and we're trying to keep it of a very high quality, high sensitivity and high specificity, by which we mean that we want to pick up every case of cancer. So we are in the process of developing this low cost and high accuracy test.
Thanks, Ranjini. We do have like 1 minute remaining on the session. So thanks all for joining in. So yeah, I think really good questions from everyone, and thanks for listening in. This was really good. We will again like try to incorporate all your feedback, the kind of questions getting asked, and spread out the awareness. We will send out the slide deck after the call to everyone. Feel free to share it with people, increase the awareness, and educate and provide protection to all the women that you know. So, all the best, everyone. And thanks everyone
Thanks
for
all.
joining in.
Really appreciate all of you for having taken time off from your very busy schedules to join us in this webinar. Thank you, actually, for joining in, and hope we are able to spread the word around.
Thanks, Ranjini. It was really nice. I think everyone is leaving the webinar more educated than we came in with. So thanks so much for your time as well.
Thank you.
So okay. Thanks everyone. We'll just conclude the seminar. Thank you so much.